I think a lot of the cases that we've heard on the national news are connected to the fact that some of the liquids or oils that were in those devices were altered, manipulated somehow. But that, with that idea, it's easy to assume that maybe if someone uses a device that is not altered, that could be maybe safer, and I would not make that assumption as of now. And even I think in the CDC data, there are cases that people are just using regular branded devices that still developed a lung injury. So I don't think we know enough to make that conclusion. Although we don't know what specific substance or maybe the way that someone is using these devices is directly causing all these illnesses, I always tell that the only thing that they all have in common is vaping itself. So vaping it's not recommended, and nobody should be using. And there are so many different ways that can be used, and so it would be very difficult to isolate just one or a few substances, because one can be manipulated, and also because there are different liquids and products that are available for consumers. We're learning more and more about the short-term risks of vaping. Unfortunately, it will take a while for us to learn about the long-term consequences of vaping. And this strategy of selling the product as something safe is nothing new. We've seen this before with cigarettes. If we see those ads from the late 40s and 50s, there were even doctors on those ads trying to promote cigarettes and specific brands as safer than others. And the same technique again for vaping.